Hi guys. I wanted to check in and give you an update. Both my sister and I were diagnosed with hypermobile type Ehlers-Danlos syndrome, which is the most common and generally least severe of the types. It's the only one that they haven't identified the gene or genes for. For the others, there's genetic testing. We're still waiting on the results of my sister's genetic testing to make sure it's not one of the other types, but clinically she meets the diagnosis for hypermobile type. So I wanted to kind of review the symptoms that are common to both EDS and multiple sclerosis, because there are a lot of posts out there about whether people that think they have MS have been tested for EDS, and it's only by a very random fluke that my sister was researching this and sent it to me that I would have made the connection. Otherwise, even with my background, I would never, ever, ever have even thought of something like Ehlers-Danlos syndrome. So let's kind of go through some symptoms really briefly, and then I'll tell you how to test and where to go to, you can kind of do a quick test on yourself to see. But basically, Ehlers-Danlos syndrome is a problem with collagen production or processing, and basically results in subpar collagen. So collagen's in it's pretty much in every part of your body. It's in your joints, it's in your ligaments, it's in your tendons, it's in your muscles. I mean, it's basically anything that holds anything together in a very, very, very general description. So some of the symptoms that I was having that could be attributable to Ehlers-Danlos syndrome, and probably are, vision issues, common in MS, blurry vision, double vision. Let's see, one eyelid closing, or drooping. I can't think of the other one right now, but it'll come back to me. But basically, those things can be due to the ligaments of the eye not functioning as well as they should, or being weaker than they should due to collagen defects, not due to neurological cause. The other one I was thinking of was the lights are very vivid at night, like neon lights. Regular lights look like neon lights to me at night. And I'll actually wear sunglasses at night because otherwise it's just too painful. But that is the muscles that open and close your pupil to let in different amounts of light. Those get weaker. Ringing in the ears, tinnitus. I've had a ringing in the ears, in the left ear, for a year and a half. Not terribly bothersome, but it's there. In Ehlers-Danlos, there are reports of people with tinnitus related to the collagen in the ear just not the structure is not as solid, so the structure changes. In one case, it was due to the inner ear ossicles, actually a part of them, tiny parts, separated from what it was supposed to be attached to. And they had to go in and do surgery to repair it. And she was having dizziness and vertigo and headaches for 10 years and this ringing in the ears. And it was actually a 2017 case at UCLA that was written up. Hearing loss in the other ear. I feel like I've lost hearing, like I don't hear the same on both sides. That too has been reported and is in an Ehlers-Danlos syndrome. It's attributable to the ear structure not holding its structure as well. TMJ is common due to hypermobile jaw, usually resulting in like occipital headaches and pain that goes around to the front of your head. And like I get retroorbital pain on the right side, but if you ask me if I have a headache, I'd say, oh no, I don't usually get headaches. But if you said, do you get head pain? Why, yes, I do. So I think I have to kind of change how I think about pain. It's not necessarily when I'm screaming on the floor. So that's the jaw. The big one was the mobility. What did I do differently that I've never done before in my life? Around the same time that I started to have worsening mobility issues, I was aggressively foam rolling. And then I also started aggressively stretching because in the reading, that's beneficial for MS, spasticity. However, if you are Ehlers-Danlos and you have unstable joints and you stretch, what you are doing is removing the spastic muscle support that is spastic because it's stabilizing those joints. So you're at risk for injuring yourself after you stretch, and your muscles are going to return to a spastic state within hours or days because they are stabilizing those joints. And that was exactly what was happening to me. So the physical therapist for EDS that I was watching, Kevin Muldowney, if you want to look him up, he's got some YouTube videos. He talks about how he has to tell all his clients, do not do myofascial release, do not do stretching, foam rolling, do not do anything that'll stretch your muscles unless you're also doing a PT program to strengthen and stabilize those same joints, which makes a ton of sense. But this highlights the need for why we always need to know the cause, because without knowing and identifying the cause, you can't be sure that what you're doing is the right intervention to address that cause. I was also taking baclofen. I've been taking baclofen for about a year to alleviate the muscle spasticity, unknowingly making my joints more unstable. So I've stopped the foam rolling, I've stopped the baclofen, and I've stopped the myofascial release. I'm going to start physical therapy. And I've also decreased my mobility overall, so I'm not doing so much intense treadmill walking. Of course, I stopped running last year. I switched to rowing so that my muscles aren't as spastic, period. So what was happening was the more I tried to use my joints, the more spastic my muscles were becoming. And because I'm incredibly competitive with myself, I always tend to go to extremes, which is why you always see me in my workout clothes, because I usually do these videos after I go to the gym each morning. So that's a big deal. I mean, for me, that was a big deal. So we're at 6 minutes. I don't want to make this too long of a video. So I want to kind of talk about, so if you think you might have EDS, or if you want to check to see if you could have EDS, how do you start that? Okay, so there's a score called the Beighton score, Beighton, Beighton. You can find the test online. It's very easy to do. It's a 9-point test. It'll ask you to do things like hyperextend your pinky. See if you can extend your pinky finger to 90 degrees or more, okay, on both sides. Obviously, you can see my left side goes a little bit further than my right because my right's my tight side. It'll ask you if you can, I think I might have shown this on the last video, touch your thumb to your forearm, which I can do very easily on the left side. It'll ask you if you can touch the floor with your legs straight, not bent at all. If you can touch the floor with your palms. It'll ask you if you can hyperextend your knees and hyperextend your elbows. The only thing I can't do right now is hyperextend my elbows, and I'm pretty sure that's because I'm so tight in my shoulders. So I want to really emphasize this point. I can't stress this point enough. If you were limber when you were younger and you're not now, you're really stiff and tight, then that is something that you need to let the geneticist know. Because if you had given me the Beighton score at any other time when I wasn't stretched or foam rolled, I probably wouldn't have been able to do the knee hyperextensions or the touching the floor with my palms, because I'm so tight. Other things that are associated that could be indicators that you may have Ehlers-Danlos syndrome. There are, if your collagen is weak, you can get these little globules that poke out here, and I don't know if you'll see it on the video, but I'll try to show you. So if I press my palms together, see that little bump? You can see it there. Those are called pyogenic papules. You can get them on your wrists, but if you look for them on your heels, when you stand with your weight fully on your feet, you can see two little bumps poke out on either side of the heels. Those are called bilateral pyogenic papules of the heels. If you have extreme and unusual stretch marks, my sister's always had stretch marks. My son already has stretch marks and he's 12. That suggests a collagen defect. I have stretch marks from my son. Most women get them on the lower abdomen. I have them in a basketball shape around my stomach. They're really extreme. And then I also have them on my thighs, and they've never gone away no matter how many squats I do or anything like that. If you have any sort of weird scars where even though they suture it closed, it tends to sort of open up and widen a little bit, that's called atrophic scarring. Mitral valve prolapse is often found with Ehlers-Danlos syndrome, but that's familial too generally. So, if you have any aortic root dilatation that's been noted, that is also one of the criteria that they look for. If you have a family member that's been diagnosed with it. And here's the kicker. here's the last section of the criteria. Must have at least one of these. Musculoskeletal pain in 2 or more limbs recurring daily for at least 3 months. Chronic widespread pain for at least 3 months. Recurrent joint dislocations or joint instability in the absence of trauma. Okay? Those first two, those are pretty much going to probably lump you under fibromyalgia for most providers. So it's not until you go and do these other tests to see, okay, am I hypermobile? And do I have these other symptoms that were called fibro and maybe something more? Does it run in my family? Remember, every parent, if it's Ehlers-Danlos, every affected parent has a 50% chance of passing it to each child. So if you would see it in a family, if you think you have it, look for one of your parents that has similar symptoms or issues. So again, that's the Baton criteria, that you can look for the Ehlers-Danlos Society, which has a checklist that you can complete and take into your doctor to ask for a referral to a geneticist. Theoretically, the diagnosis can be made by any provider, but geneticists are the ones who see it the most often. And I actually have a coworker of mine whose daughter has both POTS and what looks very strongly like EDS, and it hasn't been resolved. She even took the checklist in to the cardiologist and was told, no, it's not that. So I told her, take it back to a geneticist, sit down with him. Her daughter's got all of these signs and more. And I said, and see what they say. So that's pretty much it right now. I had an echocardiogram yesterday. I'm not sure, I might be repeating myself, so if I am, forgive me. An echocardiogram yesterday, it showed some pulmonary, it showed some right ventricular hypertrophy, which eventually will lead to right-sided heart failure. And the cause of that is usually pulmonary hypertension. And so we went and looked at that. Sure enough, I did have pulmonary hypertension. The usual cause of pulmonary hypertension is pulmonary fibrosis, or thickening of the lungs from too much elasticity. And I do think I might have talked about this. So that increased elasticity leads to the stiffening of the lungs. And again, it's related to connective tissue being too elastic. Sherpas in Nepal have very hyperelastic lungs, and they tend to get this type of pulmonary fibrosis. People who have had long-term asthma or COPD can develop this pulmonary fibrosis. I've had asthma for 7 years, exercise-induced, came on with the rest of these symptoms. Allergies came on with the rest of these symptoms. There's a huge correlation between Ehlers-Danlos syndrome and mast cell activation disorders, which is different than just your average person that's developing seasonal allergies. So if you're interested in more information, I would really recommend you check out the Ehlers-Danlos Society. There is between the lines discussion about increased incidence of MS in Ehlers-Danlos syndrome. God forbid, I hope that's not the case, that I wouldn't develop both or don't have both. For now, I'll go with Ehlers-Danlos syndrome and see how things play out. There's also in the literature, a noted increase of autoimmune issues, and I can't think of the other one, rheumatological issues, I think, associated with Ehlers-Danlos. So again, and they know there's neurological manifestations. It's just not part of the diagnostic criteria because they really can't establish the nature of the relationship of the neurological symptoms, whether it's causal, whether it's an effect, and they just need to do more research, and there needs to be more funding for more research. So I hope this helps you guys. I want to make sure that we are all as educated as possible about our health, that we are our own advocates, that we go in there prepared. I asked for an ear, nose, and throat referral to evaluate the tinnitus, the ringing in the ears. My really good primary care provider, who's gotten really on board with this, said, I don't think there's anything that can be done for that. We recommend you just go get an audiology test. I looked up an article from UCLA 2017, that one with the semicircular canal dehiscence, sent that to her and said, I'd really like an ENT to evaluate the ear structures to make sure that everything is the way it should be. And then I got a response back that she would send the referral. So those are issues in which we can, those are junctures at which we can impact the quality of the healthcare that we get by reminding the physicians that we are not like every other patient, by doing our homework and finding providers that will have a more open ear. So I hope this helps, and I thank you for your comments. I know Laura noted that I have one side of a facial droop, and I do, because this is my tight side and this is my weak side. So, and that's one of the things that I had noticed too. Strabismus, misalignment of the eyes. It's probably all related to the EDS, but as I find out more, I'll let you guys know more. All right, take care. Bye.